On this episode, we will talk about if you can get surgery, weight loss surgery, if you do have medical issues like high blood pressure or diabetes. We'll also talk about if medications are metabolized different after gastric sleeve, and we'll talk about if you can enjoy your favorite meal after gastric sleeve surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 187 of the AskDrA show. Thanks so much for joining us and sending us your questions. You're more than welcome to send us your questions using the hashtag AskDrA throughout social media, and we'll grab those questions and add them here to the list. I'll be here to answer them. All right, so on today's episode, the first question is, can I get weight loss surgery? The original question is, can I get weight loss surgery if I have high blood pressure? Well, the answer is yes. Of course, that is actually one of the indications of getting weight loss surgery to alleviate this medical condition. But it's not just high blood pressure, it's also diabetes, type 1, type 2. It is also having sleep apnea that gets way better. Also cholesterol, triglycerides, also joint pains, also swelling of your ankles, your legs. I mean, it's a lot of medical issues that get way better after having weight loss surgery. And it's not that you can't, it's actually that you should get weight loss surgery to make all these conditions way better. Second question is, Dr. A, do medications get metabolized different after the gastric sleeve? And the answer is no. But if you do have a certain medication that has a certain way of taking it with very acid liquid or very acid or different pH or very particular medication, contact your bariatric surgeon. But the short answer is no. Remember that we are not changing anything of the absorption of the nutrients or medications in this case throughout the GI tract. Remember that the only thing we are doing with gastric sleeve surgery is changing the gas tank. All right, the rest of the body, everything functions exactly the same. The only thing we're changing is that tank, that capacity to be way less. So medications will go through the sleeve, enter your small intestine, and will get absorbed and metabolized the same way in your liver. Doesn't change. And our last question is, Dr. A, will I be able to enjoy small portions of my favorite meal after the gastric sleeve? And the answer is yes, you will. So not initially, not in the first few months, but down the road, the answer is yes. I tell patients, listen, if it's your birthday, you want a very small piece of cake, why not? It's your birthday. If you enjoy a certain restaurant, will you be able to enjoy it after gastric sleeve surgery? The answer is yes, but very small portions. But yes, you will be able to adapt to any type of menu. The only thing that will be limited is the amount or quantities that will serve as an emergency brake, always on to give you a low amount of calories per day, therefore helping you lose the weight and helping you maintain it off. All right, so there you have it. That is it for episode 187 of the AskDrA show. Hey, don't forget to send us your questions using the hashtag AskDrA. Hey, and if you found this useful, give me one of these. Very helpful. I really appreciate it. And if you are interested in weight loss surgery, gastric sleeve surgery, don't forget to subscribe and activate the notifications. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.